well, pretty much since the NHS was formed. But it came in very powerfully in the 1960s, and a clique of businessmen got together in the City of London Corporation and in Wall Street in the States, big business, big finance. They got together and they organised basically an infiltration of our politics. They put together the Thatcherite movement and the New Labour movement. They were involved in the social engineering of the SDP as well. They have been targeting us for decades, and they put in a pretty robust plan to take over our NHS. As you will see if you look at the state of it now and the advice that has been pouring out of privatisation think tanks for the last 25 years, 30 years. So, the plan specifically is for each hospital to put on a large debt, a 30-year debt in most cases, that can't be got out of, that covers most of the hospital's expenses and means they've got to pay over the odds for absolutely everything. And what's worse, they can't even control things properly. They've had to outsource cleaning, and that's resulted in dirty hospitals and MRSA. So, they put a PFI debt on each hospital as a millstone to weigh it down financially. Why should that matter? Because those are public sector subunits, so having debts or not shouldn't make any difference. Well, that's true. So in 2003, through the Health and Social Care Act 2003, they separated out each of our hospitals into what they called a foundation trust, but it's actually a limited company with directors and shares, and it can be sold. The next step, 2006, they started putting the market into the NHS full steam. Started with an internal market in 2006 with Simon Stevens and co advising on that. And then the coalition brought in the Health and Social Care Act 2012 and put the NHS into an open external market with the newly incoming players, the big corporates, basically having a strong advantage. They make our hospitals compete for every penny of their funding nowadays. Extraordinary. So that was there to make hospitals suffer financially and to make it possible for them to actually break down financially and go bust, because they've been separated into separate companies that could do that. The next step was in 2009 when we had a Health Act containing what was called the Unsustainable Providers Regime. And an unsustainable provider is a hospital which has failed financially. It doesn't say anything at all about whether it's any good for its patients, but it isn't still in the black financially. Maybe because it couldn't pay its PFI bills, perhaps. And the Health Act 2009 creates a lovely legal innovation to privatise a hospital that's got into that state, or that has been forced into that state. So for the first time it becomes possible to get a hospital into private corporate hands after Health Act 2009. Then of course the coalition have let in the private sector full scale. The cronies have been benefiting copiously, I'm sure. And now we're on to the very last phase. Actually we're a couple of years behind schedule now. Our hospitals were supposed to have been gone by now, and they aren't gone. There are certainly people wanting to buy them. There's a whole bunch of American companies. There's Netcare from South Africa, the kidney trafficker. They're already in the UK with BMI Healthcare and GHD Healthcare. Those were exposed by Mail on Sunday a couple of weeks ago as the self-interested arrangements that they are and the danger to patients that they are. There's a German company called Helios, and that's been waiting for the last 2-3 years now. It was leaked that they had signed a deal to take over 20 London hospitals, but they still don't have them. What is it that they're waiting for? Well, if you have a look in the technical privatisation stuff, you can find out what it is that they're waiting for. There's an explanation by Mary Shirley, for example, who's one of the World Bank's top technical people. And the World Bank goes by a bank, but it's actually a privatisation mechanism largely. That's what's done the dirty.